Good afternoon, everyone, and welcome to the 7th and final edition of Let the Adventure Begin. Today, we're talking about what to expect after you give birth. We're joined by Dr. Soykan. He is a pediatric hospitalist coming to us live from the Center for Women's and Children's Health in Newark. Dr. Soykan, thank you for joining us. Take a minute to introduce yourself.
Hi, hello. My name is Soykan. I'm a pediatric hospitalist here at Christiana. I've been here for about 15 plus years. I'm originally from the DC area, and I've loved being here ever since we got here.
And Dr. Soykan, some people may say, I have never heard of a pediatric hospitalist. So take a minute to explain what your job description is.
Gladly. So a pediatric hospitalist is just a general pediatrician who decided that they really enjoy working in the hospital setting. This includes taking care of sick newborns. It includes taking care of healthy newborns. It includes taking care of sick pediatric patients in the emergency department and admitting them to the pediatric floor. So we do a little bit of everything, and that's part of what attracted me to this job. It's a lot of diversity. It seems to change every day, and it's also shift work. So some people don't want to work every morning. I'm kind of a night owl. I like being up at night, and I'm not much of a morning lark. So those are some of the things that attracted me to the job. Actually, the American Academy of Pediatrics recently made pediatric hospitalist medicine a subspecialty, and so people are starting to take tests and boards on that as well, because it is very different than taking care of patients in the outpatient setting.
So you would become the first pediatrician that new parents meet in that first day of becoming new parents. What should they expect when you come to see them?
Yeah, first of all, we take care of about half of the newborns at ChristianaCare. So me and my colleagues will see many of the babies. The main reason we would see you guys is because your pediatrician or family doctor can't come to the hospital to see babies. They may not have privileges or may be too far away. And so we will take care of all those babies. And sometimes we take care of the babies because the parents have not yet decided who they want to come see. You may not have picked a pediatrician yet. You may want some advice from your nurses, from the other staff. And we're here to also help support you in that. Before I even come in the door to meet you, I'm reviewing the chart. I want to make sure I know what happened during the pregnancy. I want to make sure I know how the delivery went. And I want to look for any concerns or problems that may pop up. But I also want to see, is this your first baby or your second baby, or is this your 8th baby? I want to see how you're planning on feeding your baby. Is it breastfeeding or bottle feeding? And I want to see, if there's anything else that stands out to me. After I've done that, I'm going to come in and talk to you. And I probably won't come in until the baby's 12 or 24 hours old. And that's pretty normal because we want time for the baby to declare what they're doing really well, what they're not doing well, what they're having troubles with, what's going well. And it may not seem like a lot of time, but that's plenty of time for the baby to have their first pee, their first poop, maybe to get their first bath. And even before I come in, they're going to have received their newborn medications. And those typically consist of erythromycin eye ointment, that's to protect the eyes against infection. Vitamin K, which prevents bleeding due to vitamin K deficiency, that's pretty common in newborns, and that protects them for several months out. And also the first hepatitis B vaccine in their series of vaccines. So in addition to those medications in that first bath, I come in and I'm going to come and ask you how things are going. So once I come in the door, I'm doing 3 major things. The first thing I'm doing is I'm going to be asking you about how things are. I want to talk to you. I want to get to know you a little bit and get to know the family. The second thing I'm doing is I'm going to check up on the baby. And the third thing I'm doing is I want to sort of talk about what to expect coming forward. So the first thing while I'm talking to you, I'm just sort of getting to know the baby, asking questions about how things went. And the big thing I get from parents is like, I don't want to know my baby. They're 12 hours old. What do you expect from me? You don't need to share the world of information with me. We just want to know, did they feed at all? Did they do anything at all? And I want to reassure moms and dads that it's normal not to know your baby. You feel like they've been growing inside you for 9 months, so you should really know them perfectly. But the fact is you don't. They're their own individual and they haven't had the chance to declare who they are themselves yet. So it takes time to get your baby. Be patient with yourself. Don't expect to know exactly when your baby's awake or exactly when your baby's hungry. That doesn't come instinctively. That takes time and practice. And so I try to reassure parents about that. Second on the list, I'm going to be talking to parents through the physical exam I do. So I'm going to do a full checkup head to toe. I usually start with the parts of the exam that are kind of quiet. So I listen to their heart, listen to their lungs, I listen to their belly. I want to feel the baby suck on my finger. That's one of the most important things a baby does is suck. It's one of the most important reflexes they have. And if they can suck really well, it gives me a lot of reassurance about how they're doing. And after that, I'm doing sort of like a feeling and checking. I feel the head to make sure it feels normal. I feel the clavicles to make sure they're not broken, because that can happen at birth. I feel the hips to make sure they feel in good position and there's no dislocations. I'm also looking all over. I'm looking at the skin, looking for birthmarks, looking for problem concerns like weird rashes. And I'm looking at the genitalia, looking at various other parts of the body to make sure everything is in order. Counting fingers and toes, which every new parent does also. So those are the things I'm generally doing on my exam. And I like to teach as I go along, because that's part of becoming a new parent, is learning. And we're here to support you and learning about your baby. After that, I sort of take a break and I start switching into teaching mode. And I want to go over what to expect with your baby. So the first most important thing for me to go over are what's going to happen in those first 2 days, 3 days of life. So I'm going to talk about feeding expectations. Most babies, parents think, oh, there's a set amount of baby takes every time they feed all the time. And that's just not true. It varies quite a bit, especially in the first few days of life. So right after birth, babies are designed not to get much milk. They may have really great breastfeeding right after birth because of the stress of the delivery. They'll be wide awake, looking around, saying, what just happened to me? It's the fight or flight response. And so they may feed really well at the breast or take a bottle really well. After that, they're kind of done. They're exhausted and stressed from the labor, and they need to just sleep to catch up on their sleep. They didn't get to sleep the whole time you were laboring. And at the same time, they also have a tummy full of amniotic fluid and mucus, so they're just not that hungry. So we let them barely feed for the next 24 hours, and that is okay. If they do happen to latch and feed very well, you may notice that they're not taking a lot of volume. You only have a few drops or milliliters of breast milk per feeding, and that's normal. And that early breast milk is called colostrum. Colostrum is kind of a clearish substance. It's high protein, high sugar, and kind of low fat. And it's exactly what the baby needs in those first few days of life. As the days go on, your milk will mature, you get more milk volume, but that takes time. So I just like to talk to families and let them know that this is normal, that your baby's kind of sleepy and not breastfeeding great the first 24 hours of life. And if you just put them to your chest and do skin to skin and just enjoy their company, they're imprinting on you, on your breast. This is their home base, this is where they belong. And it really gives them quite a bit of comfort. It helps them keep their temperature stable and healthy. So there's so much benefit to that. And on top of it all, it's great bonding time for you with your baby and for the baby with you. And so I don't want that to be a stressful time about parents and moms worrying about how much my baby is feeding. I want them to really relax and try to enjoy those first 24 hours, because those are the most mellow 24 hours. After that, your baby's gonna start getting hungry. So the second 24 hours of life, it's feed, feed, feed nonstop all the time. And that can be quite exhausting because you don't have that much milk. They're latching constantly, they're feeding constantly, or they're taking bottles pretty regularly. And so the second thing I like to talk about is reassure moms that not having too much milk early on is perfectly normal. It can take, like I said, about 5 days to get even an ounce of milk produced, and it might be even longer than that. So just regular frequent feedings is all a baby needs. They're designed to lose a little bit of weight. They're designed not to get that much volume early on, and just trust yourself and trust that the milk will be there when it needs to be there in the coming days. That's really hard for new parents and new moms especially. On top of that, after that, I sort of like to talk about just caring for yourself. This doesn't always come up, but sometimes I can see parents are quite stressed and worried, and they want to do everything perfectly to take care of their baby. And the fact of the matter is that's really hard on yourself. And so I encourage parents, make sure you get a little bit of sleep. It's really hard to do, but try to get it. It's really important for your sanity and for your mental health. It's also important for your milk production, believe it or not. Getting a little bit of sleep really helps with that. Make sure you get some fluids in you. Clearly, that's important for milk production. Drink your, if you need a coffee or tea, that's okay. Drink juice, drink water, whatever you need. And make sure you're also eating well. It doesn't have to be great, but it's just eating what you need to keep up with this. And trust me, when you're producing milk, you're going to be very hungry, much more than you expect, because it takes a lot of calories to do that. On top of that, besides taking care of it, get a shower if you need to. Just do regular common things that make you feel like a normal person again. And it's really hard to do after all the stress of a delivery, but I want you to focus on doing that. Finally, those are the big things I usually like to go over. Sometimes I see that parents are a little bit nervous and uncertain with their babies also. So we try.
Yeah, I was gonna say there has to be a bunch of first-time parents who look at you like deer in headlights and say, that was a lot of information.
Yeah, I mean, I don't go over all of it every time right at the beginning, but we do check on you several times throughout your hospital stay. So over time, we get through all of that information most of the time. But when they look like they're nervous and they're not comfortable with babies, especially holding a baby for the first time can be nerve-wracking if you've never done it before, if you were never a babysitter or never cared for babies in the past. So what I always do is like to go over sort of the ways that they can take care of the baby if they're not feeding their baby. So like, Dr. Harry Karp is a famous pediatrician that came out with a book called The Happiest Baby on the Block. And I'm liberally taking from that right now. But he goes over the 5 S's of keeping a baby comfortable. And they basically amount to what he calls the 4th trimester of life. The first 3 trimesters of pregnancy, the baby's inside mom. And when they're born, they kind of miss being inside mom. They miss that. And so you try to replace that by doing these 5 S's. So the first S is sucking. They love sucking on their hands and their fists in utero. Some babies even come out with a little sucking blister on their hand. That's perfectly normal and it resolves fine. But because of that, giving them something to suck on can calm them. It could be feeding them, but it could also just be a finger to suck on with a good gloved finger or a clean hand finger. Another thing you can do is I talk about like the swaddling a baby. They were really tight in utero. They were swaddled super tight. And you want to definitely try to swaddle them again because a lot of babies will get a lot of comfort in that. Some babies do want the freedom to move a little bit, but it gives them boundaries and makes them feel sort of safe and secure and keeps them warm. So sucking, swaddling, swaying is another important one. And every family rocks their baby a little bit. Well, that rocking motion is natural because when a baby's in utero, they're floating around in water. And every time mom's walking around, they're getting rocked around a little bit. And there's even a technique where you can put one hand under their shoulder blades in their body and one hand under the head and do a little jiggle. And it really can calm some babies down. So I review that with them. I review how to swaddle with them. We talk about sucking. And then we talk about shushing. Every culture in the world does some version of shushing. There are sometimes different sounds that they use, but shushing is basically mom's heartbeat. And it's quite loud in the babies in the womb. It's sort of like a vacuum cleaner in the room. So you can go shh, 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 while you're holding your baby close to their ear. And it can really be a calming noise. And that's why there are all these white noise machines and heartbeat machines that you see sold everywhere. It's the same concept. It's basically mimicking being in the womb for the baby. So it can help them get a little deeper sleep or maybe sleep a few minutes longer. And the last S is sort of stomach or side lying. We don't encourage babies to go to sleep on their stomach, but if you're trying to calm a fussy baby, putting them on their side and sort of swaying them a little bit will get them calmed down quite a bit. So I go over that with the parents, and usually I'm like, moms, you don't need this because they're going to just be feeding with you. But dads, when you're struggling to try to keep the baby quiet so mom can get an extra 15 minutes of sleep, these are some of the things you can try. So it's usually quite helpful for them. Yeah.
Is there any other advice that you would give, first-time parents like me or others? And I know right before this, you were telling me kind of it's basically like being in a reality show, those first 24 to 48 hours.
Yeah, well, yeah, I mean, there's so much sleep deprivation in those first few days of life. And even for some babies, even much longer. And it just amounts to being exhausted. So for me, I do liken it to a reality show because all reality shows, you have one thing in common. And that one thing is whether you're in the Best Baker show or in the Biggest Loser show, they're always going to sleep deprive you. They're going to put you to bed at midnight, wake you up at 4 a.m. Well, babies sleep deprived parents better than anything else you can imagine. And so when you're sleep deprived, we're not our best selves. We are tired. We are angry. We shoot off quickly at our partner, and we are not always forgiving to them. And so you need to remember they're tired too. You need to realize all our nurses are working hard, and just go easy on yourself. We understand that you may get upset because of that. So we don't hold it against you. We know it's a stressful time. And so I just encourage parents to, go easy on yourselves, go easy on your partners. And I think that'll be, you have to realize it's a natural part. I think being hangry is one thing, but being slangry is much, much worse. So.
Very important advice for sure. So what tests have to be done on the baby before we can all go home?
Very good question. So it sometimes feels like a battery of tests. We only have a newborn usually for 1-2 days in the hospital, sometimes 3 if we're lucky. And we're trying to get to know the baby, but we're also trying to do all these tests to prepare them for going home. Most of these tests are designed around the concept is that if you identify a problem early, you can intervene early and you can save the baby or protect the baby from a problem down the road. To give you some examples, the big one we do at 24 hours of life is the congenital heart disease screen. That's just an oxygen sensor on the hand and on the foot. And we're just looking to see if there's a difference between the oxygen level in the hand and the foot. And if there is a difference, it suggests maybe a heart problem. Now, your OB may have picked this up ahead of time in utero, but just in case, we like to do it just to be thorough. And some people don't get a full level 2 ultrasounds or multiple ultrasounds during their pregnancy, and that adds to caring for those babies. Another test we do is something called a hearing test. And we want to intervene in a baby that might have a hearing loss or be deaf early on, because the earlier we can teach them sign language, the earlier we can offer them a treatment, like a definitive treatment, like a cochlear implant, the better for their future brain development and growth. So we do a hearing screen on every baby. Now, not every baby passes their birth hearing screen, so that's okay. It doesn't mean they have hearing loss. But if we can prove the baby can hear, it's a really good first start. So we do that for every baby just before going home. And that may be the first day of life, but it's sometimes the second day of life. In addition, we often check babies' blood types, but this is only in a scenario where mom's blood type is a blood type O, or if the mom's blood type is negative. So if you're O positive or you're AB negative or A negative, we're going to check the baby's blood type. And that's because we're looking for a reaction between the mom's blood type and the baby's blood type. And that can lead to something called jaundice. Well, jaundice is common with every baby, even if there's not a reaction between blood types. And we will be screening your baby for jaundice just before discharge. And that's a little, like, it looks like a little radar gun. The nurses pull a trigger right over the forehead or sometimes the chest. And it gives us a measurement without doing a blood stick or what the jaundice level is. But if that measurement's borderline or a little bit high, we then usually need to get a blood level because it's more accurate. So the baby could get a heel stick for that, where they check the blood level of jaundice. And some babies do need light therapy to treat the jaundice, but a lot of the best treatments for jaundice is just feeding better and getting better at feeding. So we sometimes also emphasize that. In addition to that, certain babies have special needs. This is maybe because they're born a little premature, not too premature, just a few weeks premature. Otherwise, if they're born way too premature, they go to the neonatal intensive care unit. Or because they may have like really low body weight or really high body weight, or they maybe have diabetes during pregnancy, mom did. So in those settings, we might do a car seat test on the baby where we want to prove that they can hold their own. They're not too small. They can maintain their airway in the car seat. And because a lot of people are driving an hour and a half away, we want to make sure they don't get in trouble with that. So the American Academy of Pediatrics recommends the car seat challenge for small babies and premature babies. And then we do blood sugar testing for certain babies if they're at risk for having low blood sugar. And those are usually really big babies and really small babies, or any baby that's born to a diabetic mother. And then the last but not least, before discharge, we do a final checkup. We're going to check your baby every day they're there so we can make sure they're doing well.
And then after that final checkup, we all get to go home. What do we expect from pediatrics from there? How frequently will we then go see that pediatrician that we'll be choosing for outside of the hospital?
Yeah, and that goes to sort of picking your pediatrician or family doctor in the first place. You want to mesh with your pediatrician or family doctor because you're going to go to see them and you want to like the person you're going to see. But in addition, you want to pick someone that's accessible. For me, that means not too far away, but it could also mean someone who has great appointment, great hours for you, whatever works for you. And so the best way to do that is to talk to your family, talk to your friends, talk to your other colleagues at work, or talk to the nurses and doctors in the hospital when you get here. But that first doctor's appointment we're going to want to have happening, we're going to ask you to call and make an appointment before you even leave the hospital. And that appointment's usually scheduled for 1 to 2 days later. It's okay if it's like a holiday or a weekend that it's maybe 3 days or 4 days later. But we want that appointment because we want the doctor to get to know your baby. They need to check the baby to see how they're doing early on. That baby needs make sure that baby's not losing too much weight. Make sure your baby's not having trouble with jaundice and any other problems that can continue creeping up those first few days of life. And in addition to that, they just want to get to know you and your family. And we think that's really crucial. So if they didn't get to do it in the hospital, we want to make sure you do it right after you go home. On top of that, after that first visit, you're going to have probably a minimum 6 and possibly 8 visits in that first year of life. And that's why you need your doctor to be accessible. You're going to be visiting them often. And this is going to be for just developmental checks, for growth checks, for vaccines, and various other just concerns you may have along the way. And so it's a serious relationship, but the most serious part of it is that first year. And it's just like it's for parents, it's a very tough, busy year that first year.
Dr. Soykan, this was a wealth of incredibly important information. I know it was helpful for me. Before I let you go, what is the most important takeaway you want our viewers to have today?
I think the biggest one is go easy on yourself. I think a lot of parents come in here expecting themselves to be perfect, and there's no such thing as perfection, right? You can't be the perfect parent, but we put huge stakes on ourselves. Let me give you some examples of what I see. I see parents coming here with their like stack of organic clothes that they bought because they want the perfect clothes for the baby, or they washed them in laundry detergent that's hypoallergenic already, or they bought baby food already and they're going to make their own baby food. All sorts of interesting things you see. And that's because we're trying to protect that little bundle of joy, and we don't know how to care for them yet. So we're doing the best we can to protect them in any way we can think of, whether that's following the doctor's orders perfectly, or whether that's, seeking alternative ideas from different people. And for me, the big thing that matters is that you're doing everything to protect your baby. We understand that. And we're here to support you in that first few days of life. And we want to support you. So give us a chance to do that. And the last thing, I love to compare this, because then you see the same family come back at a year of life. and the baby's got a pacifier in their mouth and they're growing great and they look fine. And then that pacifier falls on the floor and they grab the pacifier, put it in their mouth, suck the pacifier and give it back to the baby. And so like, that's the transition that you're going to go through as a parent, from like hyperprotective to kind of like, hey, they're survived so far. Things are going all right. And I think you have to go easy on yourself, because we're all eventually going to get to that one in your life when you realize they're doing well. And people put themselves under a tremendous amount of stress, and it's stressful enough already. So that would be my first and most important piece of advice. And then make sure you get your doctor's appointment before you leave. That's what I want to do.
Well, thank you so much for all of this information. And if you're watching and have more questions for Dr. Soykan, you can submit those in the comments below, and we will make sure that he gets them and we're able to comment back and answer all of your questions.
Yeah, I'll check back with you guys and make sure I can answer any questions you have. This has been a great pleasure. Thank you so much for your time, Megan. Good luck with your pregnancy and your baby. And good luck to all the mothers out there that are going to be delivering this crazy Thanksgiving and holiday season.
Thank you so much. And we will be back hopefully in the spring after I've had my baby, and we will kind of pick up potentially right here where we left off with, how it's going and what to expect in this first few months of life. So thank you all so much and have a great afternoon.